Hello, hello. Are you able to hear? Hello, everyone. We will discuss 100 must know topics for NEET PG 2025. These are very important to remember and to revise. So, we will start the video. I hope everyone, my voice is clear and my video is also clear. So, let's start, guys. First topic is heart failure. In medicine, it is very important to revise and learn about heart failure. Second one is cardiomyopathy. Third one is atrial fibrillation. Fourth is arrhythmia and antiarrhythmic drugs. Next is BLS and ACLS guidelines. Now, in this, the important one are EDH, SDH, SAH, and Parkinson disease. Extradural hemorrhage, subdural, subarachnoid, and Parkinson disease from neuro. Another one is Alzheimer's. The most important topic of neurology is stroke syndrome, PCA, and other one is AKI from nephro. Then it's CKD, renal stones, type of renal stones, in which medium they are formed, and how to treat the renal stones. The management part of renal stones is very important. You must undergo from surgery. In autoimmune, we have SLE, Sjogren syndrome, dermatomyositis, rheumatoid arthritis. In these diseases, you have to know the treatment, the drugs, drug of choice, and the symptoms. In many cases, clinical scenario is given, and you have to diagnose the disease based upon the clinical scenario and tell the drug of choice or the treatment or the management. So you must know all these conditions. In respiratory, we have pneumonia, ARDS, COVID-19. Now, as COVID-19 is back again, many cases are upcoming. So this becomes a hot topic now. The NEET people can give the COVID-19 questions again. In gastro, we have peptic ulcer and appendicitis. Types of peptic ulcer, treatment of peptic ulcer, appendicitis, position of different appendix, most common, and the protocols of management of appendicitis, acute appendicitis and appendix tumor. Then we have pancreatitis, acute and chronic pancreatitis, management and etiology of pancreatitis. Then gallstones, inflammatory bowel disease. We have Crohn disease and ulcerative colitis. Both of these are very important. Please note down. and you must revise these both topics before going to exam. Other one is celiac disease. Now come to other topics like leukemia, ALL, AML and CML are very important. CML you have to must revise. It is ultra topic for NEET PG. Then we have lymphoma. In lymphoma we have Hodgkin lymphoma, multiple myeloma, management and treatment. Okay, and Hodgkin lymphoma I told earlier. Now let's come to Man syndrome. Man 1, 2A, 2B, 4. All these are important. All the symptoms and the condition which are associated with Man syndrome. You must revise and learn. The other one is Cushing syndrome from endocrine, hypothyroidism, hyperthyroidism, and diabetes. Diabetes is ultra. You must know the different drugs and the mechanism of action of different drugs, side effects, which drug causes weight loss, which drug causes weight gain, which causes hypoglycemia, which does not cause hypoglycemia. All these you should know. And the main difference between type 1 and type 2 diabetes mellitus. The other topics are EEG, ECG, and ABG. Basic EEG findings you should know. Different diseases, ventricular arrhythmia, ventricular tachycardia, atrial fibrillation, types of block, Mobitz 1, Mobitz 2, type 1, type 2 heart block. You should identify the conditions given on ECG. ABG in metabolic acidosis, it is very important to calculate the anion gap. You should know the formula of anion gap and the compensatory mechanism, metabolic acidosis with respiratory alkalosis or respiratory acidosis. You should know to you should know how to identify the condition based on the given findings from the ABG chart. The other one from endocrine is acromegaly. The other topic, next topic is GBS, Guillain-Barré syndrome. It was also in news recent few weeks ago. In Pune, many cases were GBS were found in Maharashtra also. Then hepatitis, type of hepatitis A, B, C, D, E. Mainly in hepatitis B, you should know acute hepatitis, chronic hepatitis based on the serological markers and antibody and antigen. IgA, IgM, IgD, IgE. You should able to identify the type of hepatitis. It is acute, chronic, window period, core mutant. Okay, you should revise that table that is given in the notes. Then in asthma management, type of drugs that are given in asthma. Now comes to dermatology. The short subjects are dermatology, anesthesia, psychiatry, radio. These are very scoring, and you can correct all the questions that are coming in the exam by just proper revising and memorizing the basic facts. The topics are skin structure, histology, appendages. The STD are very important. HIV, syphilis. These are very important to undergo learning and revision. The other one is leprosy. Leprosy, type of leprosy, paucibacillary, multibacillary, and all the regimen of leprosy treatment. The next one is neurocutaneous syndrome and psoriasis, pemphigus, atopic dermatitis, drug reaction, and tinea. These topics you should undergo in the quick revision. Does not give much time to these topics. Just undergo the main symptoms and the treatment drugs. Then we have completed neurocutaneous. These are all I have completed, and the scabies also you should undergo. Then in the ortho, the bone tumors, different types of bone tumors, Ewing sarcoma, osteosarcoma, the histological appearance and the gross appearance of these tumors, the markers and the treatment. You should revise. The named fractures like Galeazza, Montegia, and in the upper arm, Colles fracture. These type of named fracture you should revise on the last day or the 2 days before going to the exam. Nerve injuries, radial nerve injuries, ulnar nerve injuries, and median nerve injuries. These are very important. And the test to identify the nerve injured. There are different tests, pen test, card test. You should know all the tests related to each nerve. The now image based and clinical based questions are coming in the exam. So you should know which test is being performed on which nerve and which condition is diagnosed on the basis of the test given. The next disease is scurvy, rickets, Paget's, osteoporosis, osteomalacia, and pediatric orthopedics. Also, you should know. Basically, all the X-rays and the named appearance on the X-ray of all these diseases you should know. Like in scurvy, which type of X-ray or the named appearance on the X-ray of these diseases you should revise. Then rheumatoid arthritis, osteoarthritis you can do. TB, hip and spine, port spine you should revise. Next from psychiatry is depression, mania, OCD, delusion, PTSD, schizophrenia, anorexia, bulimia nervosa. These type of disorders, you should be able to tell that based on the clinical scenario, which disease is given, and you have to diagnose the patient is suffering from depression, mania, OCD. So these will be coming from the different types of questions you will undergo during MCQ practice. So please practice different types of MCQs of psychiatry so that you will be able to learn the different clinical based scenario that can be given in the exam to diagnose these conditions. And the treatment. The treatment is also important to diagnose these conditions. Sorry, treatment of these conditions should also be remembered by you. Then it is CBT, ECT. It is not, you can like just read the few lines. Now, in the anesthesia part, we have IV agents, local anesthetic, and inhalational agents. In which condition, renal disease, liver disease, which anesthetic agent is most useful, or the drug of choice, or the drug of an inhalational agent, or drug of local anesthetic agents in different types of condition, renal, CKD, liver, in pregnancy. You should remember all these point wise. Now the circuits, different types of circuit A, B, C, D, E, F. You should remember the image of different circuits. Image can come and the examiner can ask identify the circuit based on the given image. So you should be able to identify the circuit. Different types of scores in anesthesia, oxygen delivery system. This is very ultra topic for NEET also and for the NICT November people also. The oxygen delivery system, the flow rate, and the image, and it can come also in matching type, like match the different oxygen system delivery system with their images. You should remember all these oxygen delivery systems. Neuromuscular blockade. Now let's come to radio part. In radio part, you should be able to identify basic CT scan, MRI scan, uh, which is T1, T2, flare image. You should be able to differentiate between T1 and T2 images. So only basic questions are being asked in the NEET PG, like identify the given MRI T1 image, T2 image, or identify the type of CT. Now different type of chest X-ray. As I told you, different conditions of respiratory, gastro, and ortho. You should undergo all the X-ray images and identify the named images and the named structures of given X-ray. In chest X-ray, basic anatomical structures. In basic anatomical structures, you should be able to identify with on the basic X-ray the angles and the heart borders and the right atrium, right ventricle, left ventricle, esophagus, arch of aorta. You should be able to identify. On the CT scan also, you should be able to identify on the based on the cut sections of at different thoracic levels. So please undergo through these images also. These questions are very basic, but if you don't revise them again and again, you will mark them wrong in the exam. So you should undergo revision before going to exam of these basic images. Now abdominal USG, fast and EFAST. The indications of fast and the contraindications of fast, minimum volume in which we can do fast and e-fast, difference between fast and e-fast, which another area of body or the abdomen is identified in the e-fast. So you should remember all these. Next is nuclear scans. These are basic nuclear scans, dotatate, and which whatever these are gallium dotatate and CKD, contrast enhanced scans. You should remember. Barium studies, images of barium studies also in different types of esophageal condition, gastric conditions, and the intestinal conditions. The image, which is the basic appearance of different, like in achalasia, bird beak appearance, esophageal cancer, rectal cancer. In all these, we have to revise the barium images. So in upcoming, please comment. Uh, Wait 1 second, guys. Yeah. So I was saying that if you want the revision videos, please comment in the chat box. So sure, I should make the revision videos in the upcoming days. Next in esophagus, we have the esophageal management, stomach, Billroth type 1, type 2, small intestine, colon, anorectal surgery, tension pneumothorax. Type of pneumothorax is also very important. Difference between spontaneous and tension pneumothorax. Types of hernia. Like there are some named hernias also based on the location. So different between inguinal and the femoral hernia and the management part. Next one is renal tumors, Wilms tumor and the different types of renal cancers, clear cell cancer, papillary cancer, and the mutation associated with each type of renal cancer. Next is nephrolithiasis, UTI, vesicoureteral reflex, and the testes. Testes part is very important. Types of congenital anomalies associated with testes development. Then the main topic is trauma. Trauma is important in INICET, but you can undergo the basics of trauma for NEETPG. The burns, the formula to calculate the burn surface area and the management of burns based on the severity of burns. You should revise. Then the topic is wound repair, ulcer, and arterial venous disease. AV disease, the chapter of AV disease in surgery, the basic diseases you should undergo revision. Then is salivary gland, transplantation, bariatric surgery, and the blood products. These are small chapters in the surgery, and you should revise them in quick succession. Next is CNS tumors, sterilization, and daycare surgery. Indication of daycare surgery and when to discharge the patient from daycare surgery. Liver and gallbladder. Just undergo the names of different diseases and the different condition associated with liver and gallbladder, cholelithiasis, acute cholecystitis, choledocholithiasis, and the basic management of these all conditions. In liver, you can also revise the hydrated cyst part, which is very important, and the organism which causes, I think, Echinococcus granulosus causes hydrated cyst. Then the drugs in pharma, we have antihistamines, digoxin, CHF drugs, heart failure drugs, hypertensive drugs, nitrates, aspirin, gout, migraine, rheumatoid arthritis, prostaglandins. These all are very important topics for NEET PG. So you should all remember the drugs of hypertension and the basic drugs of heart failure and arrhythmias also, and the basic management of gout, migraine, rheumatoid arthritis, and the prostaglandins, which are used in different conditions of the body. Next is diabetes drugs. As I've told you earlier also, there are different types of drugs, their mechanism of action, their side effects. You should remember basically of diabetes and the insulin. Type of insulin, short acting, ultra short acting, long acting, intermediate acting, and the duration of action, 24 hours, 48 hours, less than 10 hours. You should remember all these important points regarding insulin. Next drug is atropine, adrenaline, acetylcholine drugs, organophosphate poisoning, clinical trials, drug schedules. The OP poisoning is very important. I think every year or every alternate year there is some question of OP poisoning. So management and the symptoms related to OP poisoning. There is a mnemonic which we can undergo during revision in upcoming videos. Clinical trials, phase 1, phase 2, phase 3, phase 4, in which trial efficacy is performed, in which trial patients are undertaken, in which trial post rare side effects are examined. First and zero order kinetics, teratogenic drugs, different types of enzymes, hormonal drugs, contraceptives, and PPIs, IBS drugs you should undergo and revise them properly. Next type of drugs which you have to revise are antimicrobials, anticoagulant, anti-cancer, immunomodulators, perineum, like uh, antimicrobials, anticoagulant, anti-cancer, and immunomodulators. You should revise them properly. And mainly mechanism of action of anti-cancer drugs and the side effects, and in on which body part these anti-cancer drugs act. Then in the anatomy part, we have perineum, brachial plexus, embryo, CVS, cadaver images, internal capsule, aphasia, brainstem syndrome, circle of Willis, basal ganglia, and cerebellum. These all you should be revising from anatomy. These are very, very important. Only one, sometimes one word nowadays on aphasia, there is a clinical scenario that identify the types of aphasia, conduction aphasia, Broca's, Wernicke's, and the type of area involved, and the number of uh, area 40, 41, or like this. You have to remember of aphasia. Next is azygous venous system, bronchopulmonary segment, and thoracic segments, thoracic duct, mediastinum, diaphragm opening like T8, T10, T12, aorta, IVC, and thoracic duct, etc. You should remember all the openings of the diaphragm. Hilum of lung and the series of structures from up to down and anterior to posterior, superior to inferior, and anterior to posterior of the hilum of the lung. These will be in sequence. Sometimes the questions come, arrange the following structure in sequence from anterior to posterior or superior to inferior. So you should revise that image. Then Kellett's triangle, boundaries of Kellett's triangle, epiloid foramen, relations of stomach, liver, kidney, pancreas, abdominal aorta, and the branches, inguinal canal, structures passing through inguinal canal, and the spermatic cord. Now, attachment of you should, if you have time, you can undergo the attachment of different bones. Otherwise, I don't think you should give so much importance to this topic. Next is vitamins. In biochemistry, vitamins are very, very important. Every year, 2 3 questions comes from vitamin topic, like names, side effects, drug, and the anti-toxicity management or toxicity symptoms. There will be a clinical case scenario based on the given images, and you should identify the vitamin deficiency which is happening in the patient. Now, one second, guys. Mm. Yeah, vitamins, DNA repair, rate determining steps, enzyme glycogen storage disorders. This is the ultra topic of biochemistry, glycogen storage disorder and lysosomal storage disorders. You should remember all the diseases, the main symptoms, and the management. Lysosomal, I told you, dyslipidemia, type 1 dyslipidemia, type 2, type 3, hyperlipoproteinemia, and apolipoproteins. In which cycle, which apolipoprotein works, in which like LDL, HDL, VLDL, which apolipoprotein is present, and different mainly cycles, glycolysis, gluconeogenesis, basic steps of Krebs cycle, you should remember. So these were the few important topics. And in the upcoming videos, I will tell you more important topics of NEET-PG. And up till then, I think that you should revise all these topics that I have given to you. And all the best, guys, for the NEET-PG 2025. And don't overthink that when will be the NEET PG happening. I think it will be mostly happening in the early August, first week of August. So you should revise properly and take this window as a bonus time. And you should revise properly. And all the best, guys. I hope you will shine. And please keep studying, keep hustling, and don't forget to revise. Keep revising. Thank you. Take care.